Good day, dear colleagues. I am Ustinov Maxim Sergeyevich. I am Senior Associate Professor of the Department of Radiation Diagnostic and Radiation Therapy, medical degree and PhD. First lecture is Introduction to Medical Imaging. We are starting to study a fairly long course, which is associated with obtaining, studying and using medical images in the work of a doctor. This course can be divided into two stages. This is reflected in your curriculum. The first stage, which we are starting to study now, is the initial, preparatory or fundamental. These are medical images or medical imaging. How they are obtained, what technologies exist, and what the units them into a single specialty and scientific and practical direction. The second stage will take place in your third year. There is an application of the knowledge of visualization technologies obtained at the first stage to solve specific problems of diagnosing disease of the lung, cardiovascular system, gastrointestinal tract, biliary, urinary tract, and bowel and joint system. This is such a task. I want you to imagine it clearly. That is, now we, studying technology, will not limit ourselves to this. This is laying of the foundation for the subsequent study of applied problem of medical imaging. Modern radiation diagnostic has come a long way. This is essentially a path from a period when the analysis of indirect signs played an important role in pattern recognition and in working with them. It was, let's say, not fortune-telling, but in many ways a mystery. It was intuition and a set of skills that were not available to everyone at the stage when the image was mostly shadowy. Now, radiation diagnostics has moved from a stage requiring some kind of visionary gift to the direct presentation of information about detailed anatomy, morphology, the structure of organs and tissues, and even about metabolism. In addition to this, the image has essentially changed. It has become tomographic. It has become, when we need it, three-dimensional. We have learned to distinguish, differentiate quite clearly different tissues. The following image is somewhat ironic. This image is many years old. It was presented as such an ironic preamble at one of the World Congress of Specialists in the field of radiation diagnostics. This image shows how modern medical imaging is perceived if we do not try to understand it, structure it, study it, and use it correctly. It is perceived as an accumulation of many technologies of various levels of complexity. computer tomography, magnetic resonance imaging, radionuclide diagnostics, ultrasound diagnostics, buttons, light bulbs, technologies, some incomprehensible devices. Having passed with difficult path, we get a diagnostic result. On the other hand, we got a confused patient and a doctor who doesn't always understand why he sent the patient to this study and what it do with the result and whether it will be of use. Our task during the training period is to learn how to master the entire arsenal of medical imaging and then radiation diagnostics. To perform this stage of research sequentially, which is not always correct. Sometimes it is necessary to use different techniques if it isn't possible to solve the diagnostic problem the first time. A few words about the history of our department. The Department of Radiation Diagnostics and Radiation Therapy was founded in 1956. Our department, within the framework of the concept of scientific schools, is the successor of the Leningrad School of Radiation Diagnostics. The first head of the Department of Radiology was Professor Yefim Lazarovich Kevesh, who came to Kuibyshev, now Samara, from Leningrad, now St. Petersburg. He was an incredible erudite person, possessed incredible competences and vast experience. During the Second World War, he was the chief radiologist of the Leningrad front. Professor Kevesh had a huge archive of images obtained in combat condition. Professor Kevesh's great merit for our region lies in the fact that he brought up his student, Professor Igor Petrovich Korolyuk. Professor Korolyuk is a very well known radiologist in the Russian Federation. He is one of the authors of a textbook on radiation diagnostics for all students in the territory of the Russian Federation. The textbook was created with the participation of employees of the Department of Radiation Diagnostics of Samara State Medical University, and in collaboration with the largest radiologist of our country, Leonid Davidovich Lindenbraten. The photo shows the staff of the Department of Radiology. The first on the left is Professor Igor Petrovich Korolyuk, and in the center is Professor Yefim Lazarovich Kevesh. The Department of Radiology developed a new direction in radiation diagnostic, nuclear medicine. Moreover, in the hands of the professor, we see not an X-ray, but a scan. This method has historical significance now. At the bottom, we see the cover of a textbook on radiation diagnostics. This textbook has gone through 3 editions. The creation of a federal textbook in those years and now is a pedagogical and scientific feat. Science it quite difficult to do it. The authors team of the textbook was awarded the prize of the government of the Russian Federation in the field of education. Now we will move on from the history of the department to the definition of the medical image. We will try to analyze and understand each of the definitions that we will see not just by memorizing, but by analyzing it and understanding it. Medical imaging is an area of medical science with an important clarification: clinical medicine. It is not a paraclinic. It is not an auxiliary tool used by the way, and a radiologist is not a technologist. It is not a person pressing buttons and printing radiographs. It is a clinician who makes a clinical decision and in some cases get acquainted with the medical history and conducts a survey of the patient along with a therapist or cardiologist if there is a time reserve. This field of medical science studies the use of various imaging technologies. For the diagnosis of diseases, as well as for revealing the normal anatomical and physiological pictures of the body using various types of radiation energy. Doctors, with the help of medical images, saw many new things in relation to topographic anatomy, thanks to visualization. Look at modern works devoted to anatomy, topographic anatomy. You will see that there is absolutely the right approach. If radiation diagnostics and images give a native image of intact tissue, then they need to be studied, gaining new and very important knowledge. And this image is obtained with the help of various types of radiation. Otherwise, we can say with the help of various forms of energy. By energy, we mean the flow of some kind of radiation that is absorbed, transformed, reflected when passing through the human body. What is formed a result of a medical image? We will see the phrase image. Image is a good word that is, as it were, more meaningful than just another. Science, it can contain more succinct information about what we are analyzing, what we are trying to understand, and what we are trying to use in the interest of the patient. Medical imaging is the basis of radiation diagnostics? Why is it a single specialty? Despite the extreme variety of tools, the division into separate specialists of visualization methods is the wrong approach. The first premise is that medical information is always visual. The methods of ultrasound diagnostics, radiography, computed tomography, and magnetic resonance imaging are different, but they are based on a visual image. Secondly, diagnostic information is always obtained using radiation. The term introscopy, looking inside, has not taken root in radiation diagnostic, but it exists, shows its advantages, and shows exactly what is being done with radiation. The third component is obvious, but it needs to be emphasized. All these images are digital, but there is a feature that any images has a universal format. It's called DICOM. It differs in its properties from those image formats that we use in everyday life, photographing our loved ones, animals, nature, etc. DICOM format has greater depth and power than household formats. The last point is the relationship of techniques at various stages of the diagnostic algorithm. It would be good if visual diagnostics solved all clinical issues immediately. That is, the study has been conducted, the result of the study has been obtained, and the diagnosis becomes clear. But often this doesn't happen. Several visualization methods are required interconnected with each other, which allow to consistently move from the image to nosology and morphology. This is the main task of radiation diagnostics. Why is this happening? Why are the stages of the diagnostic process unavoidable? Let's analyze this slide. Why are there many methods of radiation diagnostics? The names of various substrates are indicated in the upper horizontal row: air, adipose tissue or oil, water, liver, muscles, calcium, and metal. This is a simplified spectrum of densities that we must recognize in the diagnosis of pathological process. The vertical row on the right shows the imaging methods: radiography, computed tomography, ultrasound, and various types of magnetic resonance imaging. Look, radiography perfectly recognizes bones and metal, but soft tissue structures are poorly distinguished. Soft tissue structures begin to open up on computed tomography. Ultrasound also reveals soft woven structures. The technique of magnetic resonance imaging (MRI) allows you to reveal the pathology of soft tissues even more subtly. And now let's look at the big picture. Water is involved in the formation of a very important pathology, such as edema. The best of the arsenal of methods of radiation diagnostics, the presence of water edema will be shown by the technique of magnetic resonance imaging in the T2 mode. Another example is adipose tissue or oil. In MRI, there are modes that visualize adipose tissue well, and there is a fat signal suppression mode. Thus, you can virtually get rid of excess weight and make the image more contrasting. This slide shows that the disclosure of the pathological process requires the use of a wide arsenal of methods of radiation diagnostics. Modern radiation diagnostics has many features. The first and the most obvious is the transition to the digital era of medical imaging. Radiologists who have been working in the specialty for more than 20 years remember such things as a developing tank, fixative and developer solutions. Then there were machines that developed the film automatically. The X-ray were only on film. There was an era when they tried to make X-rays on paper in order to save silver. This is a technique of electro-rentgenography. Now, this technique has historical significance. The digital age or digital era allows you to present images on a computer screen, process and, most importantly, transmit them very quickly over special network over long distances. Let me remind you that all medical imaging are united by the fact that they are all digital and they all have the same format, DICOM. The most important point, that is perceiving at the household level as seemingly meaningless, is the expenditure of funds on new technologies. However, the approach of evidence-based medicine is not emotional but rational. Despite the high cost of equipment, estimated in millions and millions of rubles, the main question is how much investment in diagnostics will change the fate of the patient. Health cannot be weighted in the form of stack of bills. However, the costs of treating diseases, especially cancer, in the late advanced stages are very high. There are the cost of surgical treatment, radiation and chemotherapy. An expensive diagnostic technique that allows you to diagnose the disease at an early stage leads to saving in the treatment of late stages of the disease. But if you have used redundant technologies, it means that someone may not have enough of these technologies. They are not unlimited. There are many diagnostic methods. They are not cheap and they need to be applied correctly. Then we move on with you to the classification of images. We will work with this classification by moving through blocks. Image classification in medical imaging exists depending on several principles. These principles are radiation, technologies or methods, clinical directions, reflection of structure, transmission of movement, diagnostic content, nature of information. Let's start with the classification by radiation. Images are divided into ionizing and non-ionizing. Ionizing research methods include X-ray radiation, X-ray methods, and gamma radiation, radionuclide diagnostics, or nuclear medicine. Non-ionized research methods include ultrasound, magnetic resonance imaging, MRI, and infrared thermography. This classification reflects the risk of the patient health when performing research methods. It is important in limiting the risks to the patient. Ionizing radiation carries the risk of damage to the genetic apparatus, long-term consequences, which are called stochastic. Performing diagnostics using ionizing radiation methods, we can say that some percentage of our patient will have adverse consequences. But we have to consider the following concept. On one side of the scale is getting the information that the patient is interested in, and on the other side is the risk that can be realized beyond the patient's life. To calculate the risk, there is the following technique, which is shown in the figure. This technique allows you to recalculate the effective dose of the ionizing imaging method by the numbers of days, months, and years of the natural radiation background. The reference unit of this method is digital radiography of the chest organs. The active dose is 0.02 millisieverts and corresponds to the dose of background radiation that a person receives for 3 days of life. Another example. A technique that is mass-produced. All women having reached a certain age should undergo mammography. The effective dose of mammography is 0.5 millisieverts, and this corresponds to 10 weeks of background radiation. But there are techniques associated with an even higher dose of radiation. Once again, we are not talking about direct harm to health, but about the risk of adverse effects. If the diagnosis is applied correctly, the benefits obtained outweigh the risk that exposure to ionizing radiation carries. On the next slide, we see how different visualization techniques using ionizing radiation relate to each other. The x-axis represents the effective radiation dose in millisieverts. The vertical column on the left shows the annual background radiation. From the bottom up, we see various diagnostic techniques with a graphic image of an increase in the effective radiation dose. The scale begins with the digital chest X-ray with a dose of 0.02 millisieverts and ends with the contrast computed tomography urography technique with an effective dose of 32 millisieverts. On the right, there is a column of the radiation dose of 50 millisieverts. This is the maximum annual radiation dose for radiation-related workers, including radiologists. And concluding the section concerning the relationship between the diagnostician radiologist and the scope of the necessary research, we mean the concept of minimizing ionizing effect. It is called ALARA, as low as reasonable achievable. Exposure to ionizing radiation should be as low as reasonable achievable. Reasonable achievability is the use of such radiation flux and such a dose of radiopharmaceutical so that a high-quality image is obtained as a result, thanks to which a correct diagnosis can be established. This slide shows Wilhelm Conrad Röntgen. He discovered an unknown radiation which he called X-rays. In this photo, X-ray is captured with his invention, a special tube which later became known as X-ray. And it is not by chance that a piece of harsh cast iron is on the table here. This is a vacuum pump. We remember that vacuum is a necessary condition to obtaining X-rays. The next block of classification is medical imaging technologies. The first point is radiology. Radiology is a science that studies the use of X-ray to study the morphology, function of the human body, and diagnostic of diseases. That is, morphological aspects of tissues in their manifestations in X-rays. The X-ray method is a method of studying the structure and function of various organs and systems based on qualitative and quantitative analysis of an X-ray beam that has passed through the human body by obtaining static radiography or dynamic fluoroscopy projection images on a receiver, a digital detector, screen, or X-ray film. Another definition that has Greek roots is a sciology, because radiographs are a shadow image. Then sciology is the science of methods and principle of shadow image interpretation. Here are examples of X-ray images. Here are the organs where the X-ray method works perfectly. On the chest X-ray, we see inflammatory infiltration. Soft tissues do not differentiate very well, but against the background of air tissue, we see the pathology well. Bone tissue, high content of the mineral component. Pathological processes are associated with the destruction of the bone tissue, its replacement by other structures. And finally, a special mode of X-ray examinations allows you to diagnose the pathology of the soft tissue structure of the breasts during mammography. In cases where native tissue are not visualized in the X-ray stream, contrast techniques are used. This slide shows a contrast study of the stomach and the passage of barium suspension through the duodenum with the transition to the small intestine on the left. On the right, a contrast study of the urinary tract, excretory urography. We see a contrast in the cup-pelvis system and a significant change in the phase of discharge on one slide. In the center is a coronarogram, examination of the patency of the heart vessels using a contrast agent. We are talking about fluoroscopy. The meaning of X-ray is the observation of the movement process. With fluoroscopy, the process is observed in real time. Observation of the contrast that moves through the esophagus, the contrast that moves through the vessels. Fluoroscopy is the observation, manipulation of instruments during interventional exposure. Speaking of radioscopy, which is often associated with the past of radiology, for a very long time there were no endoscopic technique at the disposal of diagnosticians, and all studies of the stomach and intestines were based on the fact that the patient took a contrast agent and the radiologist observed its movement through the digestive tube. However, fluoroscopy in modern conditions has another very important application in interventional radiology. The X-ray surgeon saw the problem, performed minimally invasive manipulation through the vessels under the control of X-ray examination, and then looked at the result of his intervention again. The following method, which can be considered a close relative of the X-ray, method. In fact, this is one specialty. The full name of computed tomography is X-ray computed tomography. We mean that the image was obtained using X-rays. Computed tomography is a layered radiation study based on computer image reconstruction by processing information from detectors about the absorption of radiation in the internal structures of the human body during circular scanning with a beam of X-rays. What are the fundamental points of definition? Firstly, it is a reconstruction, and secondly, it is no longer a film, but a set of discrete detectors located on the tube. Information from them is read immediately after absorption of radiation, and scanning takes place in a circular manner. There are several generations of CT scanners. The main method of conducting this study is multi-slice spiral computed tomography. Once again, we emphasize the features of computed tomography. The main advantage of the method is the highest contrast resolution, which far exceeds the capabilities of projection X-ray technologies. This is mainly due to differences in tissue absorption coefficients. With computed tomography, radiation passed through a thin layer of tissue. As a result, there is no overlap or blurring of structures located outside the selected slices. The image in computed tomography is reconstructive, not shadow. There is no projection pattern on the detectors. A reconstruction is a complex process of processing the received data on absorbed radiation. A reconstruction of the first tomograms many years ago were carried out for several hours, and now it takes a few seconds. Multi-section spiral computed tomography (MSCT) simultaneously with the constant rotation of the tube plus detector system. The table with the patient moves continuously and linearly. There is a spiral movement of the fan beam through the body. The detectors are arranged in several rows. Multi. Numbers of rows is 32, 64, 128, 256, 320. Tomographs of the first generation had one line of detectors, which was located opposite the X-ray tube. Now there are many of these detectors, and they are arranged in the form of a series of clips. A large volume of tissue is scanned. The more rows of detectors, which are called slices, in another way it can be called multi-row, the faster the tomograph will work. Spiral computed tomography allows you to create accurate, multiplanar, and three-dimensional reconstruction. Images are created in axial, sagittal, coronal projections, as well as any other projections of interest to the doctor at many angles to the human body. An increase in the numbers of detector rows leads to an increase in the cost of the tomograph. Currently, a reasonable compromise is 46 or 128 rows. Let's look at some examples of how computed tomography is used. Here, the diagnosis began and almost ended. It's almost clear. On the right image, liver metastases are clearly visible. In the left image, we see a malignant tumor that has all the signs of invasive growth, germination into the surrounding tissue, damage to the pleura, germination into the chest wall. Acute violation of cerebral circulation, a serious problem. It ends tragically for the patient. The patient can be saved and provided with a good restoration of function if a timely diagnosis is made and proper treatment is carried out. The slide presents two classical situations. In the left image, the area of tissue that has a low density is an ischemic stroke. I remind you, this is a negative image. The small density is closer to black in color. The opposite situation is shown in the right image. There was a violation of cerebral circulation, which is accompanied by hemorrhage in the brain. The blood clot will have a higher density than the surrounding tissue and will manifest as a denser component. Currently, the word tomography has become a daily occurrence and has come to almost every family along with a new coronavirus infection. This is due to the fact that pneumonia in COVID-19 has a very characteristic feature that facilitated the diagnosis of the disease. Coronavirus pneumonia is characterized by a symptom that the entire population of the globe now knows, and previously only specialists in computed tomography knew. This is a symptom of ground glass opacity, which consists in increasing of the density of lung tissue, but the alveoli also retain airiness. Bronchi shine through these areas of ground glass opacity. Vessels shines through. It also turned out that if the data of the virus RNA tests are questionable, then the result of computed tomography becomes decisive. Next slide. There are other techniques. Spiral tomography in angiology allows you to make a three-dimensional reconstruction, which in previous cases are completely unnecessary and would only interfere. When diagnosis pneumonia and strokes, three-dimensional reconstructions are not needed, and in this series, three-dimensional reconstruction allow the angiosurgeon to orient himself in the state of the vascular bed and make the right decision about operative access and how to solve this problem. In the left image, we see a vessel stenosis, and in the right image, we see a massive aneurysm. An aneurysm is a formidable condition. The aneurysm wall is often untenable. Its rupture is possible. We have just seen the movement of radiation diagnostic from guesswork, assumption, and intuition to direct anatomy. Three-dimensional reconstruction of multi-section spiral computed tomography in interventional radiology. Modern reconstruction methods make it possible to paint these structures in different colors for convenience. Bone tissue is colored in one color, vascular structures in another color. Three-dimensional reconstruction makes it possible to look into the lumen of the vessel. In the left image, the outer volume of the vessel is reinforced with a special mesh made of metal alloy. In the right image, we see an internal lumen showing that its patency is preserved. Magnetic resonance imaging. The essence of the method requires a separate, careful consideration. The information obtained by magnetic resonance imaging is not density, it is a completely different signal. The phenomenon of nuclear magnetic resonance consists in the ability of the nuclei of a number of elements having the properties of dipoles, for example, hydrogen, carbon, fluorine, phosphorus, under the influence of a powerful static magnetic field to absorb the energy of a radio frequency pulse, moving to a higher energy level. Returning to the previous level, the nuclei release energy in the form of a magnetic resonance signal. In the first place, when used as the main element in magnetic resonance imaging is hydrogen. This is convenient due to the technical features of the device and because hydrogen is present in all organs and tissues in human body. A computing system is used to obtain magnetic resonance tomograms. A magnetic resonance tomogram is created by localization, the distribution of the magnetic resonance signal in space. The quality of magnetic resonance imaging depends on the strength of the magnetic field. The unit of the measurement of the magnetic field strength is Tesla, TL. The higher the magnetic field strength, the better the ratio between the signal and natural noise, and the higher the image quality. The standard is high-field magnetic resonance imaging 1.5 Tesla, less often 3.0 Tesla. The cost of equipment increases non-linearly, abruptly depending on the magnitude of the magnetic field strength. Earlier, we noted that depending on the mode of operation of the magnetic resonance imaging machine, images of various organs and tissue look different. The mechanism that controls the tomograph causes the tissue to separate from each other by relaxation time is called pulse sequences. These pulse sequences act on tissue in different ways. We can see this tissue and pathological process in this tissue better when comparing imaging from different pulse sequences. The main ability of the magnetic resonance imaging method is the differentiation of soft tissues. The next slide shows the pulse sequences during magnetic resonance imaging of the brain. There are sequences T2, T1, T2 flare, T1 plus gadolinium. The massive tumor process is visualized differently at different methods of tissue excitation and signal registration. They reveal themselves differently as normal anatomical structures. For example, the differentiation of white and gray matter is clearly visible in the T2 and T1 modes and is practically absent in the T2 flare and T1 modes enhanced with gadolinium. Thus, by controlling these modes of magnetic resonance imaging, we achieve a very detailed visualization of the resolution of the soft tissue component in pathological process. As we have already understood, computed tomography is not magnetic resonance imaging. Computer tomography solves its problems and magnetic resonance imaging solves its own. These two methods overlap in cases where it is necessary to analyze in more detail the pathological component in soft tissues detected on computer tomography. The opposite situation. The task of a detailed analysis of the structure of lung tissue to identify multiple foci of destruction of the pulmonary parenchyma, evaluation of the pulmonary pattern, evaluation of the smallest structures in a thin layer of lung tissue is carried out using computed tomography. Such an assessment is not possible with magnetic resonance imaging, unlike the assessment of brain structures. Another example on the next slide. It shows the ratio of computed tomography and magnetic resonance imaging in the diagnosis of soft tissue pathology. The undoubted advantage in the detailing of soft tissue is shown in the right figure using the magnetic resonance imaging technique. There are no good and bad visualization techniques. There are techniques that are used for their intended purpose, applied correctly, and there are techniques that are used in situations where they do not make sense. This concludes the first lecture. Thank you for your attention.